Hello everyone, welcome back to the UKMLA Roadmap series where we walk you through the MLA content map. Today we're going to talk about infection, and the first one is acute cholangitis. Now this is a very important topic. It is a frequently tested topic. Do the presentation really well, do the management really well, do the examination of the abdomen really well, and know how to interpret lab findings, okay? So this could show up in your multiple choice questions or your OSCE stations. So do it well. Next you have brain abscess. Now brain abscess usually shows up as an MRI with a ring enhancing lesion on it with a background history of infection, immunocompromise, or central nervous system symptoms. So just make sure you familiarize yourself with what a brain abscess looks like and the causes of a brain abscess. Next you have breast abscess and mastitis. Look at pictures of this, okay, because you could get pictures. And also make sure you look at what advice you need to give the patient on breastfeeding. So usually breastfeeding mothers show up with breast abscess or mastitis, and you need to tell them about what they need to do when it comes to breastfeeding. Okay, so learn the examination, the management, the presentation, the pictures, and the advice you need to give the patient. Okay, next you have candidiasis. This usually shows up as oral candidiasis in the case of an asthma patient taking a steroid inhaler, or vaginal candidiasis or vaginal thrush in a female patient with cheese-like white discharge. Okay, so do both of these cases really well, and also in immunocompromised patients. Okay, immunocompromised patients may have candidiasis. So just make sure you look at pictures. Make sure you look at the history you need to take. And in the case of oral thrush, it's usually a white plaque on the tongue, which can rub off and leave a red inflamed lesion behind. Okay, so make sure you know how to advise or counsel the patient about their inhaler use, about hygiene, okay, and the drugs you need to use if you need to use any drugs, okay. So candidiasis very frequently shows up. Do it well. Next you have cellulitis. Look at pictures of cellulitis. So they could give you really any body part with cellulitis, but it usually is the lower limb or the foot in an immunocompromised or diabetic patient. So do that well. And another thing about cellulitis is you need to know the drugs that you will use in this case and the alternative to those drugs if the patient is allergic. Okay, and it may show up as an emergency scenario as well in your OSCE stations. They love to test you in your multiple choice questions on this topic as well. Next, you have chlamydia. So if it's chlamydia, if it's gonorrhea, if it's HIV, I think there's another syphilis, right? So all these STIs, what you want to keep in mind with all of these STIs is a very, very important thing you need to keep in mind is the genitourinary medicine clinic and the partner notification program. Okay, the partner notification program, the genitourinary medicine clinic, the swab tests you might need to do, the drugs that are going to be used in each respective case, okay, and how to diagnose these particular conditions, how to advise the patient on safe sex, okay. So just make sure you cover all of that when it comes to all these different diseases. In particular with human immunodeficiency virus, you may need to adopt an approach where you do breaking bad news. Also know that lymphadenopathy or recurrent infections may be present in human immunodeficiency virus, okay, and what you're going to do for the patient. And also, in this particular case, you may need to talk about health insurance or workplace limitations when it comes to human immunodeficiency virus as well. Okay, so that's the deal with all these STIs. Okay, next you have conjunctivitis. In the case of conjunctivitis, you need to look at the pictures of conjunctivitis, mild, moderate, and severe. Pictures of pink eye. Know the difference between viral and bacterial conjunctivitis, what you need to do in each of those cases, okay? Can show up in your multiple choice questions or your OSCE stations. COVID-19 hasn't been showing up as much in recent times, in very recent times, but it could definitely show up. So just do the presentations, do the management. Next, you have crew. This may show up, so know the findings in this case, know the presentation of the patient in this case. They'll love to test you on this in your multiple choice questions. Haven't seen it as much in your OSCE stations, but can show up, so do it well. Next, you have cutaneous fungal infections. So know the different cutaneous fungal infections: Tinea cruris, Tinea capitis, Tinea facies, wherever it's present, depending on where it's present, the name changes, but know the treatment of tinea, right? What kind of topical treatment you're going to give the patient, and look at pictures. Definitely look at pictures, okay, of cutaneous fungal infections. You may get a multiple choice question or an OSCE station. Sometimes you might even get an OSCE station where the patient is on the phone with you and you have a picture of the fungal infection with you, okay? And also know what precautions the patient needs to take. The patient should wash their hands. They should avoid touching the lesion. They should avoid sharing towels or clothing with anyone else, okay? Next, you have cutaneous warts. So cutaneous warts are human papilloma virus infection. Know about HPV, take an HPV history, take a sexual history. Know the different stains of HPV. In particular with human papilloma virus, you might have to perform a speculum examination and do a cervical smear. Know when a cervical smear is done. But on top of that, you might just get a station where you need to take a history for HPV and diagnose HPV. So just make sure you look at pictures of this and also know the management where you might give them a miquimod or topical treatment with an ointment or cryotherapy. Okay, next you have encephalitis. This usually shows up as viral or bacterial encephalitis, more so viral encephalitis, where a relative shows up complaining about their son, their father, some kind of immediate relative, and that particular relative had a viral illness or a previous illness, and now they're acting confused or acting in weird ways. They aren't themselves. Maybe they aren't as alert. Okay, so that's how encephalitis may show up. Know that this is a scenario where you need to admit the patient, know what you're going to do in this case. Next, you have epididymitis and orchitis. Make sure you ask them about mumps. Make sure you ask them about their vaccination history. Make sure you warn them about the complication of mumps, that is infertility. But on top of that, know how to examine epididymitis and orchitis, because you might get a combined station, or you're more likely to get a combined station where you actually have to examine the testes, okay, and know what you're going to do in these cases. Next, you have folliculitis. This is usually a case where a patient has shaved their face or their pubic area, or they've had waxing done, and you'll get a picture of the pubic area or their face. So make sure you look at pictures of folliculitis and familiarize yourself with that, and know what you're going to do in this particular case. Okay, this is something that has been showing up more frequently in recent times. Next, you have gangrene. Know what gangrene looks like. Look at pictures of gangrene. Know how to examine gangrene. Usually shows up in diabetic patients with gangrene in their extremities. So know what you're going to do, and also know how to counsel a patient for amputation. Okay. Next, you have head lice. Head lice is a case where a mother may show up with complaining about her daughter scratching her head a lot. And you need to know what to do in the case of head lice. In cases of mild, moderate, and severe head lice, this has been showing up in recent times. Next, you have herpes simplex virus. Know the history, know how it spreads, know what you need to look out for, and also look at oral herpes and what it looks like. So look at pictures of herpes simplex as well. Okay, next you have hospital-acquired infections. Now, these you'll just learn as you go through the different topics. You'll know which of the infections are hospital-acquired, okay? But usually hospital-acquired infections, you might have to isolate the patient maybe, okay? But in particular, you just want to make sure you know what setting the patient is in and what is more likely to infect them, which agent is more likely to infect them. And in hospital-acquired infections, it usually is a specific kind of bacteria that infects them, okay? But this is more of a generic topic, and you'll cover it as you go through the different topics, so don't worry about it too much. Next, you have human immunodeficiency virus. We've already talked about that. Next, you have impetigo or impetigo. So honey-crusted lesions. Look at pictures of this. Know what to advise parents when they are concerned about their child going to school, if their child can go to school or not. know that this is caused by Staph aureus, and just, yeah, usually it's just a picture that you have to look at and diagnose the condition, and also advise the patient on going back to work, or a child on going back to school, okay? Next, you have infectious colitis and diarrhea. Both of these cases take a history of diarrhea. Is it watery diarrhea? Is there blood there? What's the consistency? What's the frequency? Is the patient dehydrated? Right, your normal run-of-the-mill gastroenteritis or any kind of infectious colitis or whatever. Just make sure you take a thorough history of their bowels. Next, you have infectious mononucleosis, and know which organisms may be affecting them, okay, and how they must have been exposed to those organisms, okay? Next, you have infectious mononucleosis. Know how this is spread. This will usually show up in an adolescent, and they'll have infectious mononucleosis, and of course you need to diagnose the condition, manage the condition, all that good stuff, but also make sure you keep the enlargement of the spleen or splenomegaly in mind. So if they're an athlete, tell them to stay away from contact sports until the infection resolves, because they could rupture their spleen. Next, you have infectious endocarditis. This usually shows up in the case of prosthetic valves or maybe IV drug abusers. So know which organisms are involved, which drugs you're going to give in this particular case as well. Shows up a lot in multiple choice questions. Haven't seen it show up as much in your OSCE stations, but still do it well. It does show up. Next, you have influenza. This is pretty simple. It's a simple flu. Simple advice to the patient, right? No antibiotics. Tell them it's going to take a week or two or a few weeks to resolve. One important thing you want to talk about is flu shots. So if the patient has been getting the flu quite a lot, and it's really annoying, once the flu resolves, tell them to come in and get a flu shot, okay? So keep immunization in mind when it comes to this. Lower respiratory tract infection or pneumonia, okay? Now, lower respiratory tract infection could also be tuberculosis. Could be pneumonia, could be tuberculosis. You can see here. So make sure you look at x-rays, okay? X-rays of the chest. Make sure you know how to interpret x-rays. Make sure you familiarize yourself with what all those infections look like on x-ray. Make sure you know what to look at in sputum cultures or the lab investigations, and all the different kinds of antibiotics. It could show up as a prescription scenario, as an exacerbation of COPD in an emergency scenario. It could show up as an IV drug abuser with pneumocystis. It could show up as a community-acquired infection, maybe an infection in elderly. So know all the different organisms and all the different cases it could show up, and the antibiotics you need to give, and the chest x-rays, and yeah, just make sure you look at all of those things, know all of the findings, do it well, because it does show up in a multitude of different cases and scenarios. Now, we're just going to make this a two-parter, okay, and I'll talk about the rest of the infectious diseases in the next video. Thanks for watching.